most famous physical therapist on the internet.
Hi, folks. I'm Bob Shrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course,
Yeah,
Bob.
we got to take a pause once in a while. Today we're going to talk about the best hip stretches for pain-free activity. This is great for 50 and over people. Most of these are fairly simple to do.
Bob, there's no need to tie yourself into a pretzel to stretch out your hips. This
Sure.
is going to be good for, I really think, for the majority of our viewers. 92%.
Absolutely. Great. Well, one thing, Brad, just be careful if you have rheumatoid arthritis or if you have really loose joints.
Or a hip replacement.
Yeah, or hip replacement.
Right.
Good.
Then you should, just watch.
Yeah, always use your common sense.
That's right.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com, go to the giveaway section. This week, we're giving away some Pro Pods.
Ooh.
Now, these are really handy for mobilization of your hip, and you'll have to check it out.
Yeah, well, there's a number of
A
things.
number of things you can do. You
Work
can really,
your muscles out. Good for your feet, the bottom
you
of
can
your
do
feet.
balance. Go to the giveaway section. It'll also be on Facebook. It'll be pinned to the top of the page. Go to Twitter, Instagram, or TikTok if you want a 60-second version of our program. And Brad, what do we have now?
What?
A podcast.
A podcast. That's right. I was trying to think of how good we are at advertising and talking about these giveaway programs.
All right.
Anyways.
Let's start, Brad.
Oh, yeah. Okay. Hips. So I've got some new hip stretches that I've done personally for the first time in the last couple of weeks. And you're familiar with them too because we got them from a guy who is really into it, a professional actually.
Yep. Where's my book?
Right here. The Supple Leopard.
The Supple Leopard by Dr. Kelly Starrett. Chock full. I'm telling you, I've been reading this for a couple weeks and I'm only partly through it because there's so much information. Really good if you're in the athletic field or lifting weights but even for the elderly.
Right. 50 and over, I think this is great because I'm over 50 and I started doing this one. It's like, it really is not hard to do. And it really gets my hips in the areas I have not felt before. So you simply, and I like it because it's laying down, and you can relax.
Lying down.
Lying down. I'm sorry.
You've been on vacation, Brad.
I'm out of the sink. So just go like this. I call it like a horizontal squat, position, like in a seated position, and then bring your feet out a little bit, and you'll feel the stretch in the hips to start with. And then what I do is I just basically push my knees apart here, and I'll do it with my elbows. It's a little easier. And then just position yourself.
Then try to go closer,
a little closer and a little wider, and everyone's hips are going to be a little different. And just hold it 15 to 30 seconds. And I've got a really nice stretch going right now.
Brad's going to breathe relaxed. And also, as Dr. Starrett says, you not go into the pain cave. If this, stay away from the pain.
Yeah.
This should be not necessarily comfortable, but it should be tolerable.
And right now, it's just feeling better. The longer I'm here, the more relaxed it feels.
Yeah, if he says it feels funky, don't be doing it. If
Right.
it doesn't, it is funky if something doesn't feel right. So
I'm a happy person right now.
I like this stretch.
Yeah.
It's funny. You and I must have the same brain, Brad, because
Well, don't go there, Bob. I don't even want to,
Yesterday I did the same. I did the exact same stretch yesterday for the first time.
Oh, the first time.
Yeah.
Excellent.
All right. Next
Now,
one, Brad.
This one is one of my favorite ones for many years now. This would not be the best stool. I do it on a solid stool, but or a solid bench.
Yeah, you don't want one that rotates.
Right. And what we're going to do is the height is going to be different for everyone. You may need to start on a chair that's just lower. I actually like a little bit higher than this one, but I've been doing this for a long time. And I just stretch like this, and you can see the hip is flexing to a maximum range. So it should, again, feel good. Again,
and you can do pressure on, pressure off. You don't have to do a hold stretch.
If you want to, I've been reading about that, Bob. Just book I just read, they talked about sustained stretches being better than the holds.
Oh, are they?
But I think you really got to do what your body says.
I'll tell you, it's controversial because I've seen studies that said that stretching does not help, but then they found out stretching does help people who did it. It doesn't even make any sense.
You got to listen to your body.
Yeah, listen to your body.
Yeah. Okay. Now let's go to the next one.
What are we doing now, Brad?
I can't remember.
Yeah.
The kneeling one.
Okay, I'll do the other
You
one.
get to show them this
All
one.
right, so this is for the hip flexor stretch. I like this one. I do it every day. You can put a pillow down if you're old like me, so you have it easy on your knees. And I'm going to be stretching this hip flexor right here. No, I'm sorry. I'm stretching this hip flexor. So I'll
Yeah, do
go
the
around.
other one so that you can see. The line on your pant leg is really nice. See,
So you
that's the
start off,
femur.
I'm going to keep my body nice and straight, my
Yep.
back straight, and I'm going to lean forward like this. And that really gives a good stretch to there. And you can actually put your hand on your pelvis and push forward even a little further.
If you look at the line from the shoulder to the hip and then from the hip to the angle, as a therapist, that's the angle that we're looking to improve. And I got to say, Bob, there probably aren't a lot of 60-year-old men who have that range of motion.
That's one of the few motions I have.
and this is where, yeah, so it really shows. So if
Yeah.
you do this and you don't get that far, don't worry.
Don't worry.
Yeah.
You might only go this far. And if you want to start putting a little more stretch on it, you actually turn the foot out a little further.
Yep, out this way.
Yep.
Gets that hip
And
flexor.
you want to do both sides.
Absolutely, both sides. Otherwise, you start walking in circles. That's a bad joke.
It's a dad.
Anyway.
It's a dad joke. All right.
All right, now the next one. Oh, this is one, and this may not be for everyone. If you feel comfortable, you may need some balance for some of us older people. You go down like this. You already have flexible knees. You can go full range on your knees and your hips. And then I personally like this one. I just put my elbows in and I push my hips out, and I can really get a nice stretch on those hip abductors and work on that.
Yeah, that might be a tough one for some people.
Yeah, there's some people it's not going to be because they don't feel comfortable in this position. So just skip it if it's not.
Or the alternative,
relaxed.
Brad, you can do one leg
The
at
one
a time.
legged, sure.
And you can balance yourself on this side. Grab your ankle and then push your elbow
Here,
out like that.
Face straight towards them so you can see that force what you're doing right
yep.
there.
So
There
you're
you
doing
go.
one leg at a time, and that's the one I've been doing.
Yeah,
That
you
was
know-
a Kelly Starrett too.
People that if you're having tight hips, you got to get them stretched out.
Yeah.
You got to prevent that
Mobilized,
replacement.
and the whole works. Okay, Brad. Now you got some ones to do here.
Yep.
buddy.
Ones now we're going. Those are the more maybe advanced, if you will.
Yeah.
These can be done in your bed actually,
Sure.
or on a carpeted floor. We'll show them on this just because it's easy to video. But the first one is just the old grandfather stretch hip.
Yep.
Single knee to the chest. There's no weight bearing on this, so this is a really good one to start out with. These other ones were like, those are too much, too advanced. This is a good way to start.
Yep. Wake up in the morning and start
Yep.
pulling that leg towards you.
I've tried that wake up in the morning, and I need to get around a little bit.
Sure.
Right in bed, some people are going to find it good, and if it doesn't feel,
And some
you're
people
ready-
it kind of wakes them up,
Yep.
but other people.
Yeah. Now this is the one. Oh, I've really been finding this one good. Ever since I got a hip issue right now. I think it's my piriformis or my low back, but this windshield wiper exercise is a nice one.
Great one for getting things moving in the morning because all night long it was still. It was not moving, and joints don't like that.
And look at my shoulders; they're flat.
Yeah.
Especially for 50 and over, I think you can hardly go wrong with this. And to keep those knees together.
Brad and I have had thousands of patients do this one.
Oh,
It's all for back pain or hip pain. It's just a great one to start with.
Exactly. Now this next one, I'm going to turn the bed this way a little bit so you can see what
Sure.
I'm doing. This is like the clam shell. You go like this, and if you can clam shell, bring your knees out like this. If that gives you a good enough stretch, that may be all you're going to do.
Gravity itself, probably.
Yep, just relax like this. If like for myself, this doesn't really feel like much, so I'm going to advance it. I'm going to go up like this, and I'm going to I'm going to use a stretch out strap. You can use a belt, or if you got really long arms, you could just grab around. And then I go here. I like the stretch out strap because I don't have to grab and pull. I put my wrists in there, and it's easy. And now I'm just pulling my feet in towards me, and my knee and my elbows are here on my elbows. You don't have to do that at home.
I hope he rolls off because this would make a great outtake here.
I don't know. If I'm getting a nice stretch, and I can relax while I do this with the stretch out strap. Oh, Bob, this is these are wonderful stretches for those hips.
I can see.
I'm starting to feel like I gotta go out and run a marathon now.
All right, figure 4, Brad.
Oh yeah. Now you want to do it seated or?
I'll do it seated.
Yeah, this is a really nice one because you can do in bed, you can do it lying on the floor or in a chair.
So
And
got me. So basically, it's very easily. You just put the ankle on the opposite knee, right above it, and you're just going to push down like this, and you can do this throughout the day, and that's what's nice. Brad can show it there lying in bed, but this way you can really get a lot of torque when you're sitting up like this. I'm trying to keep my back fairly straight, but there's no reason not to do this one because you can do it, whenever you're sitting in a chair.
yeah, and you'll know if these are tight because if you have a hard time when you're sitting to cross your leg over your knee to put your socks or tie your shoe, then this should be done. More
what
often.
you can do if you can't do it, you can start off like that.
Yep.
Even you can start by pushing on the floor and then work your way up to getting back
There
onto the knee.
And then when you're lying down, you would start with instead of the knee up and crossing, you start with the knee down like this, and then you work your way up like that as tolerated.
You want to do that last one, Brad? The leg off?
Sure, the hip flexor stretch.
Another way to do it.
And this is one you have to do on a bed or possibly a couch, but
just watch your shoulders; they don't get too close to the edge.
We don't want people rolling off. That's obviously a pretty serious problem. So my shoulders are on. I just scoop my butt over till my right cheek because I'm stretching the right leg. Go slightly over and relax. And let gravity do the stretch here. If you want, you can grab this knee and pull up, and it helps lock the pelvis.
You can see how tight the muscle is because he actually pulls up when he pulls that pelvis up.
Yep.
See that?
Everything's connected together.
But he's got pretty good motion there.
Yeah, it's. I'm doing all right, Bob. I really don't know what to say, Bob. I'm just gonna finish.
All right. So remember, Brad and I can fix just about anything
except for
a broken heart, but we're working on it.
That's right. Oh yeah, no,
clear.
If you're going to use them, I think they go like this.
Yeah,
you got to
go like that first.
I don't think they use those anymore.
I think that thing I don't think they use that anymore.
Yeah, I don't think they use it. They got that machine that talks to you, and then it's not like the old days where boom.
Yeah, everybody clear.
Yeah, that's too bad.
Okay.
Anyways, good luck.